Hi, I'm Dr. Kathleen Janelle. I would like to talk to you a little bit about Clostridium difficile, also called C. diff. So C. diff is a bacterial infection that's most often a result of using antibiotics. And there's a few antibiotics that are more likely to cause this problem. One is clindamycin, the other are cephalosporins, ciprofloxacin, levofloxacin, moxifloxacin, and ampicillin. So those are like the top of the list in terms of when you take those antibiotics for infection, there's a likelihood that it could cause a C. diff infection in your intestines. That C. diff infection causes intractable diarrhea, abdominal cramping, and it's dangerous because you could lose a lot of fluids. So we have to treat that. And because itself is a bacteria, we have to treat it with antibiotics. So the first line of antibiotics that we're going to treat it with are antibiotics by mouth, fidaxomine, vancomycin, and metronidazole, some kind of combination of that. The problem with that treatment, and why, if you're familiar with this or you've had it yourself, it can come back after you take these antibiotics to treat it, is because the antibiotics will treat the vegetative state of the bacteria. The bacteria also has a spore state, and the antibiotics won't touch that spore state. So let's say that 25% of the C. diff inside of you is in a spore state and 75% is in a vegetative state. You take the antibiotics, it clears out that 75%. You stop the antibiotics and your system is weak, and that 25% spore is now able to overgrow inside of you and cause symptoms. So that's an important part to differentiate, because a person can do the antibiotic treatment for C. diff, recover, and then it will come back. That person is back in the hospital or at the urgent care, and the treatment that's recommended for that first reoccurrence is another course or similar course of antibiotics. They can go home and again be fine for a while, and then the symptoms can come back again. And the treatment at that point, at the second recurrence, is now being recommended to be a fecal microbial transplant, an FMT. That is the transplantation from a healthy donor who has a diverse microbiome. Diversity is equal to health in an ecological system, and there's an ecological system living inside of you in your small and your large intestine, primarily your large intestine. And like all of the laws of nature, diversity in that system is the healthiest. Taking antibiotics is what lowers the diversity. It's one of the things that lowers the diversity. So it lowers the health of that ecological bacterial population inside of you. So the antibiotics are one treatment. The fecal microbial transplant is a treatment that will treat both the vegetative and the spore state. So it's a more effective treatment. Right now it's not regulated to be used until the second recurrence of C. diff after 2 antibiotic trials have been done, and there is definitely a cost problem with it. Right now, drug companies are taking the components of that fecal microbial transplant, and they're trying to find either a synthetic or a refined version of that that can eliminate some of the risks of infection. And once those clinical trials and clinical development has been accomplished, then that's something that will be available, hopefully, to be used at the first occurrence of C. diff. It becomes really effective, and that'll be a pill or an oral form. Something to keep in mind also is probiotics, because probiotics can be helpful in the course of treating C. diff. It might not be the first thing that your doctor recommends, but certainly I would start them right away in very high doses. We're talking 300 billion of a diverse species sample, at least 300 billion daily. And that's the same dose that I would use when giving any patient antibiotics. I won't allow my patients to take antibiotics, and especially that list that I read earlier that had the antibiotics that are more likely to cause C. diff. But regardless, I won't write a prescription for antibiotics without a high-dose probiotic, 300 billion per day, taken at least an hour away from the antibiotic dosing, so we can prevent this problem from happening. And there's a third option, which is a sterilized fecal microbial transplant. That's currently available more as a supplement category of treatment. And so we can give it to patients at their initial C. diff diagnosis, at their first reoccurrence, to treat preventively to treat someone who has more of a proclivity towards C. diff, so that we can prevent problems with that. And I've used it for other forms of intractable diarrhea, like inflammatory bowel disease, microscopic colitis, lymphocytic colitis, those kinds of things. So it can be a helpful treatment. It's not 100%, but it's certainly worth the cost of taking it, given what the options are for treatment and recurrence. One more thing, there are carriers of C. diff. That's how you get it in the first place. It's not like it comes in with the antibiotics. It's already inside you as a spore form for a certain number of people. And so when you take the antibiotics, it basically frees up the real estate so the C. diff can take over. So there are some very sensitive PCR tests out there right now, more of the functional tests, but some national labs have them too. And so if they test positive for C. diff presence, that doesn't mean you have C. diff. You have to have the toxin tested for to know if you have an active C. diff infection, not just the presence of bacteria, because treating someone with the C. diff protocol just because they're a carrier would be an over-treatment and overuse of antibiotics and may cause other problems. Feel free to ask me any questions that you have about C. diff, and I want you to be well.